Welcome back to Lockdown Anatomy. In this video I'm going to look at the knee joint. It's a wonderful complex joint, lots of components, lots of different types of movement going on in that joint. Once again I'm using the fantastic 3D4Medical Complete Anatomy app. If you've got the app you can maybe use it at the same time as watching the video or just sit back and enjoy a bit of anatomy. So here are the bones of the lower limb and we're homing in on the knee. Spinning around to the back then to take a look at those femoral condyles articulating with the tibia. Really the knee joint comprises three joints. It comprises two tibiofemoral joints between the condyles of the femur and the condyles of the tibia. And then if we spin back round to the front again, of course, there's the kneecap, the patella, articulating with the femur. So there's also a patellofemoral joint. Now, all of those joints are enclosed within the same synovial capsule. The knee is a hinge joint, but it's a complex hinge joint. It's not just flexion and extension in one plane that happens at the knee joint. It also has a rotating movement, so the femur can rotate on the tibia, and there's a bit of sliding going on in the knee joint as well. So now I'm just going to look at the tibia and tip it so we can see that top end, that proximal end. And this is what we call the tibial plateau because it is relatively flat, although it has an eminence in the middle where ligaments attach. And I've just labelled up the medial and the lateral sides here just so we can get that into our head. The first thing we want to do when we look at any bone or joint is to orientate ourselves. So we can see on that tibial plateau that the medial condyle is larger than the lateral condyle. And there's something else that we can look at to help us side the tibia, of course, and that's down at the bottom there, the medial malleolus, which forms the knobbly bit on the inside of your ankle. But we're just focusing on that top end of the bone that contributes to the knee joint at the moment. And I'm going to start adding layers of connective tissue on. So what we can see here very clearly are two crescent or C-shaped pieces of fibrocartilage. And these are the menisci of the knee joint. They are effectively incomplete articular discs. So there's the medial meniscus, which I always think looks like a capital C, and the lateral meniscus, which is smaller and rounder, so it looks more like a lowercase c. In the front there, we've got a transverse ligament attaching between the anterior horns of the menisci. And then there are these ligaments that attach diagonally between the femur and the tibia, crossing over each other. And that's why we call them the cross-like or cruciate ligaments. There's the anterior cruciate ligament, the ACL, and it's anterior where it attaches on the tibia. And at the back then, we have the posterior cruciate ligament, PCL, and it's attaching posteriorly on the tibia. They cross over, so actually the posterior cruciate ligament attaches more anteriorly on the femur than the anterior cruciate ligament. We can see another ligament here as well, the posterior meniscofemoral ligament, which attaches into that lateral meniscus and splits around the posterior cruciate ligament. So it's already starting to look quite complicated. Let's add on the femur. And I'm now adding on the synovial membrane, the synovial capsule of the knee joint. So the knee is a synovial joint. It's lubricated by synovial fluid. The articular surfaces of the femur, the tibia and the patella are lined with hyaline articular cartilage. And then we've got those menisci on top between the tibia and the femur. What we can see when we add that synovial membrane on is that we can still see that posterior cruciate ligament. So in fact, the cruciate ligaments are not inside that synovial capsule. It's almost as though they've been pushed into the capsule from the back. So they're lined with it over the surface of them, but they're not inside the capsule. Let's add on another layer. And of course, as in most synovial joints, there's then a fibrous capsule. So that's what we're seeing here. And that attaches around the articular margins of the femur and the tibia and the patella as well. Now we've got another couple of ligaments, the lateral and the medial patellofemoral ligaments, helping to keep that patella in place. If we add on another layer of connective tissue, then we start to see some more ligaments. That's the fibular collateral ligament there on the lateral side, attaching from the femur down to the head of the fibula. Collateral ligaments are present in all hinge joints. They help to stabilise the joint at the sides and constrain that movement in that plane which allows flexion and extension. So if there's a collateral ligament on one side of a joint, there'll be another one on the other side. So over on the medial side, we have the tibial collateral ligament. And the fibular collateral ligament is cord-like and quite separate from the capsule of the knee joint. But the tibial collateral ligament actually blends with that capsule medially. And on the medial side, inside the knee joint, the medial meniscus is firmly attached to the inside of the joint capsule and thereby to the tibial collateral ligament as well. So the medial meniscus is much less mobile within the joint than the lateral meniscus. And that seems like such a good idea, but actually it means that the medial meniscus is the one that is more prone to injury. What we can also see, having added in this extra layer of connective tissue, is that there are pockets or pouches of fluid around the joint. And these are called bursae. There's one above the patella, which is deep to all the muscles there, and that's called the suprapatellar bursa. And then below the patella, we have an infrapatellar bursa. And in fact, there's a couple of those, one deep and one more superficial. So this is the deep infrapatellar bursa, just between the tibial tuberosity there and the patella. Add another layer in and we see more ligaments, but we also see some more bursae appearing. And what we can see is that there's a bursa right in front of the kneecap, the prepatellar bursa, and another one which is superimposed on top of that deep infrapatellar bursa, and that is the subcutaneous infrapatellar bursa. Let's add on some muscles and tendons, and now we can see how the deep and the subcutaneous infrapatellar bursae are separated by that patellar ligament. So quadriceps tendon comes down to the patella, and then beyond the patella or below the patella, quadriceps tendon is referred to as the patellar ligament, which then inserts on the tibial tuberosity. And in fact, there are lots of other bursae associated with the knee joint, tucked underneath ligaments and tendons, making up 12 bursae in total. Now I just want to have a look around the back of the knee again, and I'm picking off that skinny little plantaris muscle which descends down into the calf so that we can get a really good view of this other muscle, popliteus. So popliteus exists deep within the popliteal fossa, which is the pit at the back of your knee. And this muscle arises from the tibia and then flows laterally to insert on the lateral condyle of the femur. So this animation shows it with the leg, the tibia and the fibula, and the foot hanging freely. And we can see there that the action of popliteus is going to be to medially rotate the tibia. So there it is, it glows, and we just get a little bit of medial rotation. You can see the great toe pulling in there as popliteus shines. But in fact, popliteus is much more useful when you're standing on your feet and your legs are extended. When the knee joint is fully extended, there's a locking mechanism that puts tension into ligaments so that in fact you can relax a lot of the muscles around the knee and stand upright without having to use lots and lots of energy and lots of muscles to do that. And that locking mechanism involves a medial rotation of the femur on the tibia. It makes sense to talk about it that way round because your foot and your leg are the parts that are staying still. So usually when we talk about medial and lateral rotation, we talk about the distal segment of the limb in relation to the proximal segment. This time I just want you to think about the proximal segment in relation to the distal segment. So we talk about the medial rotation of the femur on the tibia in order to tighten all those ligaments and lock the knee. Well, that's great, but once you've done that, if you then want to flex your knees again, you've got to unlock the knee. And unlocking the knee is going to involve a bit of lateral rotation of the femur on the tibia, and this is what popliteus does for you. I've already made a video about the muscles of the thigh, so I'm not going to go into those in a lot of detail again, but let's just notice quadriceps there, converging on the patella with the patellar ligament below. That is the main extensor of the knee joint, a great big chunky muscle in the front of the thigh. And then round the back, we've got the main flexors of the knee joint, and they are the hamstring muscles, biceps femoris, semitendinosus, semimembranosus. And if I pick away plantaris again, there's that little popliteus muscle at the back of the knee joint. Taking almost all the muscles away and looking at the anterior surface again, we can see a tiny little muscle there called articularis genu. and this muscle contracts during extension of the knee, it's not doing much to the knee joint itself, but what it does do is pull the suprapatellar bursa up and out of the way as the knee extends and the patella rises up on the front of the femur. There it is on the other knee, and next time we'll move down to look at the muscles of the leg. If you enjoyed this video and found it useful, please like, please share, and please subscribe to my YouTube channel. See you again soon.